Now I have the honor of bringing up the panel. These are the folks who really know what's going on. These are the folks that are really making a difference. I've already apologized to the panelists for the brevity of the introduction, but in the interest of time, I'm just going to give them a very short introduction. Now, as I introduce them, if they'll come on up. Dr. Amanda Dove is a full-time primary care physician at the Wellmont Health System in Rogersville. She has a special interest in rural medicine, nutrition, and preventive care and wellness. She's a Blountville native, and a graduate of the Quillen College of Medicine, completing the rural primary care track during her training. Perry Stuckey is Senior Vice President and Chief Human Resource Officer at the Eastman Chemical Company and a true advocate for health and improving the quality of life in our region. All of you know that Eastman is one of the largest companies in America, the 30th largest exporter in the country, and has played a major role in promoting health both in the community and among its employees. Mitch Miller is the CEO of the Washington County Economic Development Council. Their mission is to enhance job growth and increase the tax base in Washington County by engaging community and business leaders and by recruiting and retaining industry and commerce, clearly exactly what we've been talking about. Mark Kinser is the Executive Vice President of General Shale in Johnson City. They've been a vital part of this community since 1928. They offer corporate sponsorship not only to ETSU but to many other community services and as a major player in the economic development and status of our region. And Linda Buck is the President and CEO of Rural Health Services Consortium, which is an agency that has been working in Northeast Tennessee since 1985 to provide health care to folks regardless of those whether they can pay or not. And I am going to stand here. And what I'll do, if it's okay with you all, is I'll start in the order I introduced you, and just ask if you all have any thoughts or comments about what you've already heard, and then I'll ask you some specific questions, and then we'll open it up to the audience for questions as well. So, Dr. Dove?
Well, I have to say I'm honored to be asked to be on this panel. I'm a small piece of a very big picture, and I'm glad it includes such a diverse group. I feel a kinship to all of you because I think we're all devoted to the same cause, that healthcare and wellness is a human right, and everyone deserves an excellent chance to get it. The barriers I see where I work in Rogersville are the same barriers that are everywhere: time and money. Time to spend with your doctor or your healthcare provider to really get the support you need to make those behavioral changes. That doesn't happen in a 15-minute visit. And the money to pay for it, because it isn't free. And when the mean income in this region, which is my home, is $27,000, and if you have to pay cash for every healthcare item you receive, that doesn't go very far. And it's sinful to have to choose between nutritious food and clothes for your children and their education and good preventative health care. The other barrier I see is nationwide problem. The way doctors and providers are paid is honestly pretty ugly. We're paid for illness. We're not paid to keep you well. That's changing in a slow way, in small ways. I think that's going to be the main revolution that needs to happen in healthcare, is that it's more profitable to keep people well and encourage them to stay well and be healthy and stay in the workforce than to wait until they're sick and pay an enormous bill to try to get them back there. So I'm glad we're here, despite the recent developments with Insure Tennessee. I'm glad we're still here, excited to talk about this.
Thank you. Perry, what are your thoughts from the corporate perspective?
Well, I think you hit it. First of all, thank you for inviting us. And this is a marathon and not a sprint, Dr. Wyckoff, as you know. When you live in a region like this, listen, and I've lived in 10 states in the U.S. I've lived in Wisconsin, which was kind of at the top of your list in health quality prior to coming here. You know, it's behavior, it's what you consume. It's you know, we need your help to help educate our workforce. So let me give you a quick illustration. If there's a kid who grows up in a lower socioeconomic household that's very bright, but if that family doesn't have access to health care, and say this could be a young kid that could be a valedictorian, and if he's in a household that for the first 12 years of that kid's life that they couldn't afford health care and they haven't been doing the preventive work, that young child is going to show up would likely to have be more at risk for medical conditions because they're not getting the routine check, they're not going to the dentist, not getting the physical every year. That impacts. And even though this may be a very bright and smart child, it's the income level means a lot. So for us at Eastman, we're trying to address this on all of these fronts. That's why we partner with Rick Johnson, who you'll hear in a few minutes, for Healthy Tennessee. I serve on that board. We know that it's working with the academia for quality education. It's working with our colleagues on this panel to have a more highly educated workforce. That's important. We need to attack these issues from all of those perspectives. And look, whoever buys the groceries in a household control the health of that household because whatever food's being prepared, there's a lot of processed food. And you know, if families are poor, they're going to buy more processed-related foods than fresh fruits and vegetables. Then it's also accessibility. And if you're out in the county and you take an elderly citizen who doesn't have appropriate transportation, the bus system's not running out, they can't get to the right grocery store to buy it. So these are all major issues that we need to really address collectively as a community, not just us on the panel, but many of you in the room and many of you who are not on the panel out there have been working with us to do this. And that's why we have to approach this and get after it. And we are dedicated to making a difference in this community.
Thank you, Perry. Mitch?
Sure. Well, Perry, I'm glad that you said that, and I'm glad my wife buys our groceries. So she certainly helps me out with keeping a little bit healthier lifestyle than I probably would myself. In economic development, we've got so many issues that we deal with on a daily basis as we look to recruit jobs, help companies like Shale grow, whatever it may be. We talk about taxes, we talk about accessibility, we talk about workforce. You know, so many times when we talk about workforce, it's the skilled training. Can they weld? Can they go in and fix a machine if something messes up? And we tend to overlook the health of our workforce. It's an important factor. We've got to promote a healthy workforce. We have to work to educate those folks, work with our existing companies in the process because those are our testimonials as we look to go out and recruit. They know the folks because they hire the folks. It's important in so many ways because a healthy workforce is a good workforce. And the more that we can promote that, kudos to our city for all that they do and really putting great amenities like the Tweetsie Trail and so many things that they're doing to help promote a healthy lifestyle. You know, that's what's important in our industry, and when we look at things, workforce is always the top priority as we look to really enhance our region and grow our region and tell a story of our region. So if we have a good workforce, if we have a healthy workforce, it's going to help us do our job. It's going to help me do my job. It's going to help Mayor Humphreys do his job and enhance Carter County and so many other things. So it is important. It's extremely important.
Thanks, Mark.
Thank you for the opportunity. What I've already heard this morning is exactly what I had hoped to hear today, is that there's no one group that can fix this problem. It takes the entire group in this room, from educators and employers and healthcare. We have to work together in this. Shale is fortunate. I've worked for the company for 37 years, and the minute I walked through the door of my company, I had insurance. I've had it all those years. We've had a lot of employees retire with 40-plus years of experience, and they've had insurance every single day. And I'm going to pick on Shale a little bit because we're part of the problem, as are most employers. We have created an environment of a free product with no accountability. And that's got to change. And about 6 years ago, we started with a wellness program within our company that has intensified. To be quite honest with you, that's the one thing that caught our attention about Insure Tennessee. And I won't speak to the whole, I'll speak to one thing that we saw was the fact that we were going to provide something from the government level that had accountability to it. And that's impressive to me. That's where we have to be. As a private employer, asking our employees to live well, to act well, to play well, be safe, I can't do that and try to educate them if, as a government, we're providing products with no accountability. It just doesn't work. The same thing when our employees come to us, the question about during the interview never is, tell me about your wellness program. You know, what can I do to be accountable? What do you do to offer me at work a better lifestyle and a better way of living? It's, well, what's your deductibles? What's your copay? The day that this room comes together and we've got a mentality where an employee is being interviewed and they want to know about the wellness program of that company, That's a win. But it's going to take everybody in this room. And I'll finish with a couple of comments. The issue here is, I wish this was a mentality. What we see as an employer is not a mentality. We can fix that with a good communication program and a good PR program. This is a culture issue. Most people will tell you that change the culture of any organization or any business is 5 to 10 years. Well, this is society. This is where we are in Tennessee. And being an employer in 14 states, I can tell you this. The last year we measured the claims that we have paid in the state of Colorado per employee were half of Tennessee's. So the economics that a student never hears is that all of his employers have a bucket. And we're all competing in our industry as manufacturers, retailers, service providers. There's a bucket of what you can pay your employees, and in that are all the benefits. So if your health care costs are higher, your pay is going to be lower. You got to compete. You get the health care costs down, and this is what young people need to hear at home and at school, is you do have a part in this. You can help your wages in a community by helping the way you live and helping impact that cost. So when Mitch recruits for this community, he's got a higher wage scale to talk about. So I'll leave it at that. I think what we hear today is important for our future, but we've all got to talk on the same page.
Great. Thank you. Linda?
Thank you so very much for asking me to be on the panel. When I first came to rural health, we had annual reports that we had to produce. And in those reports, at the top of the page was Dr. Wyckoff's name. And so certainly in this region, to have someone that has the ability to crunch data, give us facts about the health care of our region, we're very fortunate, Dr. Wyckoff, to have you, and ETSU is very fortunate to have him as well. You know, statewide, there's about 30 primary care health clinic groups with around 200 satellite clinics. That's not a lot for all the population that we have to serve. In that service, we have to, certainly about 80% of those reporting are below, at or below 100% poverty. And how do we do that? Primary care is the fundamental basis for the health care structure. And to do that, it takes, it takes funding. And certainly we do the best that we can. I think there's around 500,000 visits, half a million users that actually comes to a health center in the state. And, again, with that said, they're the ones that is referring out to the specialist and taking care of those individuals that are not really even accountable to their own self. So again, I believe in value, quality, cost. All of this is a ripple effect. And with that, I do feel like that if we are able to expand, that there's going to be around 1,500 jobs, maybe even around $909 million of income that's going to be brought in, and to be able to do what we do and do it better.
Great, thank you. I have some prepared questions, but as the students in my class know, sometimes I deviate from the prepared. And I'm struck by the incredible perspective that you all bring. If each of you could maybe say a few words about how the other sector could help you. So in other words, in the primary care delivery side, how could local industries benefit what you do? In the business side, how could economic development, education, and so on benefit you? I don't know if that's a fair question. Any of you can answer it, and then I'll come back to the prepared questions in a second.
Well, one of the problems I see when I'm seeing someone who's working at a job that they end up having to pay for their health care, or they have a really high deductible plan, time away from work to see me is a big problem. And a lot of times they have to take their PTO if they have it, or they just have to beg for it. And I sometimes have to write letters to say, yes, they were really here in the office, and please don't penalize them at work. Don't give them a point on their attendance. So if there was some way we could work together more closely with getting access, whether I go to the plant, for instance, one day a month and see all of my patients that work there and they don't have a penalty for that. Some way we could work together for that.
Okay.
Yeah, let me make a brief comment that I think how I could get a lot of help from the academia and the education and even the parents in this room is teaching our students and our young people about nutritional health habits and appropriate portion control. That's important because a lot of the health issues are behavior related. It's what we consume. It's lack of physical activity to get our population engaged in being physically active, and exercise and nutrition. Because remember, our body only gets energy from sleeping and eating, okay? And so if we get the proper sleep, we get the proper nutrition, that's part of this fitness routine. It's really important because when I'm trying to attract scientists, engineers, and chemists from around the world, and they look at this data and they look at the quality, the poor quality of health in this region, it's a detractor for making them want to come work here. And so I lose some time very well-known potential employees because of this healthcare issue that we're faced with. And obviously, we do business in 100 countries around the world. Tennessee and Texas, which is on the bottom of that unhealthy areas, costs us more from a healthcare standpoint. So those are all issues that I'd like to stem the tide and turn that around by working with our hospital system. So if you could help with the education and awareness, that would be a tremendous assistance for us at Eastman.
And I would agree with Perry on the education. Starting young, talking about healthy eating, living, I mean, that's the workforce of our future. And we have to start young there. Two, engaging not only industry and with the healthcare side of things. I'm seeing more and more, and I'm sure Eastman has this with the size of their company, but recently visited A.O. Smith and NN. Both in their facilities, they have gyms, and they promote healthy lifestyle, encouraging workers to work out. If we can do the same and really in getting our healthcare systems into there as well, I'm sure that we can enhance that, enhance our workforce and the productivity out of our workforce. So I think they're all important and certainly can engage.
I will probably echo what Perry said. Healthcare issues in this region really are good. They really are. In the state of Tennessee, we really have no issues. HIPAA, whether you want to hear it or not, really kind of limits what an employer can even discuss anyway. So our hands are tied there trying to coach and mentor sometimes just because of HIPAA. So that, like it or not, that's where we are. But, in this room are a lot of parents and a lot of educators. And I'll get back to the point that I made earlier is, we all understand the health benefits of living safely and living well, living healthy. But it's also got an economic side that as you go from that 20-year-old that's learning this in college or you learned it in high school, as you move through the workforce, the healthier you live, those do have economic impacts. And the thing that's interesting to me, and I'll use an analogy to answer the question, all of us in this room in education and as a parent spend a lot of time in the early age with our youth talking about car insurance, how you should drive safely, how you shouldn't speed, don't get tickets, take driver's ed, maintain a B average, keep that driver's insurance down. We talk about that. They hear it all their life. When do we ever talk about you have a responsibility to your family and to your employer to live safely, to eat healthy, to live a good lifestyle? That needs to become part of that growing up mentality, same as car insurance. It's right there in front of us.
One of the things that Rural Health has been trying to do is impact more in the schools, and we have actually acquired a couple of mobile units and some fixed sites in some of the school systems. And the best way to, to assist a child to stay in school and to graduate, as you talked about, was the fact that to keep them in school and to maintain, the healthier lifestyle and give them the education to do so.
Great, thanks. I'll revert now to the prepared questions, but let me ask Mitch and Perry and Mark, if you could think about a situation where you were trying to recruit a company or an individual and were unable to do so either because of a health or education related opportunity in the region. Can you sort of share how that plays out and how that has a ripple effect in our region? Maybe Mitch, start with you. And then
Sure. It's probably more on the education is where we've experienced that more than any. It stems down to, you know, work ability, really our workforce, what they're skilled in, but I think you can tie that into health as well. Not to pinpoint an example here, but to really talk about, and I'm sure both of these guys beside me can relate to this. Look at Tennessee. Look at our region. Two things that we can relate to. Diabetes, heart disease, all preventable. I can only imagine the impact on the healthcare costs that it has for both of these guys. And as we bring folks in, you know, we have to rely on our existing companies to tell a story and help us in the process of recruiting. And if that question comes up about healthcare and the costs and the impact that it has on their business, that can hurt us. That can put us at a disadvantage. You know, fortunately, I can't pinpoint really a position that we've been in with that today, but it's possible.
yeah,
And I think it's an extreme issue that we really need to look at.
it might even prevent someone from even getting to the point of talking to you.
It's very true.
Perry and Mark, any thoughts on that?
Yeah, I'm going to go back to your question. It was, give an example where the inability to recruit someone was directly related to the health of the region. So let me give an example. First of all, let me say this about the region. I think I love the region. I think, as you said, it's a beautiful place. It's got a lot of natural beauty, and that's what attracted me here. So I am a proud advocate of this region. We will run into situations, for example, there may be a kid in the household that has some type of a severe condition, and they are looking to see if the right physicians in the area in terms who can treat that child. And every now and then, if they do research on the hospital system and they don't feel good about a particular specialist, they may turn us down. I've had that to happen. That's rare. One thing I can tell you, I partner a lot with our healthcare providers in this region, and they work very closely with us, helping us attract talent. And I do reach out to them, and many of you from an academic standpoint. You know, when people come to relocate to a region, there are three things that drive their decision to come. First, if they're happy with Eastman, or happy with Dumtar, happy with General Shale or the company, and then they're pretty okay with relocating to the region. The number one thing they look for is schools, because that's important. You know how they say, you know, real estate is all about location, location. You could change that to schools, schools, schools. And that's the university system, that's the public school, elementary schools. That's important because parents want a well-educated household. They want to give their kids the best. The second thing they look at after that is they look at the quality of the health care in the region. And that's important. And then probably a third after that, they look at the amenities and accessibilities. What does the region have to offer in terms of entertainment? What is a big city and the proximity to Asheville and other places like Nashville help us out in that regard. And so having a quality education, having a very quality healthcare system and hospital system is paramount to our success. And also having amenities, movie theaters, other things, that's important to people when they're thinking about living here. So that's really important. We have to work on all of these in our region, and we have to work together as a community to make this a very attractive place to live.
Where this would impact General Shale the most, the recruitment process is not, the healthcare cost is not a huge issue because, as Perry stated, the beauty of this region, the healthcare facilities, what ETSU brings to this region, recruitment is not difficult. Where this impacts us is, you know, as we're deciding where to build the next brick manufacturing plant or a stone manufacturing plant, a concrete manufacturing plant, you do your models, it's all financial, and employment is in that financial model, and in there is a huge cost of healthcare. So when you do this modeling, you're naive if you think that the healthcare cost for your region is not going to impact where the next manufacturing facility would go if you're looking to your company's bottom line, and that's what we're responsible for.
Great. And Perry and I have had this conversation before, but from the higher ed side, one of our challenges is spousal employment. So we can attract good faculty, but if their spouse can't get a job in the local business environment, that's a challenge for us. So again, the whole thing is interrelated. I'll ask all of you, whether it's a small healthcare business or others, talk about some of the things that your companies have done for your own employees to try to focus on improving health from your company out into the community. And I'll let anyone start.
I want to defer and let some of my colleagues on the panel start first. I feel like I've been starting.
Oh, no, not at all. Well, we'll break it up and start at this end, perhaps.
You know, they usually say that whatever field you're in, you're the worst at it, I guess. And so basically, you know, at our company, we kind of energize ourselves with pedometers, the Fitbits, encouraging healthier lifestyles, that type of thing, but nothing that would shake the earth. But again, our goal is to look at what is needed and move forward in that area.
I think most of the companies in this room could comment on a health and wellness program. As I mentioned earlier, we really got into this probably 6 years ago, and it's growing every year, every month. We have a wellness committee. It's cross-sectional of the company. We have a Facebook page for communication. Communication is key. It's got to be about their well-being and not the company's bottom line, as sometimes they see it. It's important to everyone. You know, generic drugs that are for wellness are 100% paid for. You know, I can go through a lot of things that we do as a company, but again, it's the communication. When this new employee comes on board, I'll give you a couple of statistics. Health risk assessments is part of our wellness program, and we require that during open enrollment. And I'm very proud of General Shale's 1,300 employees across the country, and I think we do a good job. And the good news is, when I say that we have 52% of our employees take a health risk assessment, that's above the benchmark for my industry, so I'm proud of that. But the question is, why is it not 100%? Why is it not 95%? So again, it's kind of a mentality of where we are with this whole thing and about being part of this instead of me against them.
So I'll talk briefly about some things we do at Eastman. Listen, you know, look, long before I showed up here, Eastman had a journey of health and wellness. We received the Everett Cooper Award for it. We have 4 or 5 on-site fitness centers. We take a holistic approach to wellness. We charge less money in our cafeteria for the healthy food. The unhealthy food costs you more. We subsidize it, so we want them to choose the healthy food. We have over 87% of our employees take the health risk assessment. We do, one thing we're very proud of, we partnered with the local hospital, and we've also been partnering with the YMCA recently in a cardio prevention to people who are at risk for diabetes. We have a program we're starting. We're going to be partnering with the YMCA to do this, and not only targeting our employees, but their family members, because it's just not our employees we're concerned about their kids, their family members, and we need a healthy workforce coming behind them. So we've also been working with some of the local restaurants on healthy cooking classes we offer on site. So we do a lot of those things, and probably one of the things that our employees were a little bit upset with me and the CEO about is that we've gone through and we've taken out most of the unhealthy food in our cafeterias. We've taken out some vendors who could not meet our health standards on what we wanted to be feeding our population, and they're no longer on site. So look, because we care. We want our employees to live a long and healthy lifestyle into retirement and spend time with their grandkids, and we have to teach them what they're consuming, the nutrition, how that works together. So for us, it's just not about, we're talking about one dimension of wellness. The other thing we're working on too is being fatigued, because mental, we care about work-family balance. That's important. We also care about their spiritual well-being, because that's another dimension of wellness. So you got to think about wellness holistically. And I'm taking a holistic approach around wellness, and is one of the advocates in our company, along with our senior leadership team, to do that. So, and we need your help in the community, because Your sons and daughters come to work for us, and the more you can educate them on wellness, the easier you make our life.
Like most of us have mentioned here, my employer, Wellmont, does have a health coaching and wellness program internally for our employees and their families covered under our insurance. One of the facets of it that is impressive to me is for our diabetic employees. If you participate through the health coaching program specifically for diabetes, your medicines and your testing supplies are all free, which removes a huge barrier of cost that a lot of folks don't have access to.
I think, you know, it's obvious that we all want a region that's the best place in the country to live and work. Is there anything that we're not talking about? When you envision what the ideal region would be, is there anything we haven't brought to the table that you think is essential to succeed in the vision that you have for this region? Sorry to ask easy questions, but I thought.
I'm going to bring up a topic that I alluded to earlier. Look, I think we cannot leave out the transportation system in this region, particularly when I think about our senior citizens and their accessibility. For those who don't have a vehicle or can no longer drive, they need to catch public transportation to get to places. And if all of us keep living long enough, we're going to live to a point where someone's going to take our car keys. And when that happens, we need to have accessibility to be able to catch public transportation to get the things. Otherwise, they're at the mercy of someone bringing them this in. And I think we really have to look at that component in this region. It doesn't impact our workforce as much as it does those seniors in the community. And so, Dr. Wyckoff, I think that's a segment of our population that we don't need to forget about as we address this issue in our community as well.
Yeah, and we don't talk about this, but the last time I saw statistics was about 10 years ago. But the Tri-Cities region was the 10th oldest metro area in the country by average age at that time. So issues of aging and transportation and so on become very important. Other things we haven't brought up.
Well, to touch on that too, our business is to promote to the outside what is going on within our region, and a lot of that's coming full circle here as I'm thinking, what are we doing to promote within? Maybe we need to focus more with existing businesses. I'm going to pick on Mark. Mm-hmm. What if we went to Mark and talked about the amenities here that we have within this region, from hiking to getting out on trails to whatever it may be, and do your employees even know about it? You know, maybe that's on us to do that.
You know, they say in marketing, the challenge is to convince your ideal customer to buy your product. We have to figure out who the ideal person is for this region and present the right picture to them.
Yep.
All right, others? Anything we're leaving out that we should be thinking about? Lynn?
I think the future for rural health and the population that we serve is certainly integration. And in most of our sites, it being so rural, you know, once the patient is in one of our facilities, they need to get everything they need to get for that day. Because traveling, as he said, and transportation is an issue. Sometimes family members are bringing, maybe even the trans vans are bringing them to our clinic. So again, I really do believe integration into every area, whether it be behavioral, whether it be mental health, whether it be being able to get any type of diagnostic testing and everything is key. So integration into different services, integration into definitely all needs for that patient.
I would add that when we're promoting physical activity in particular, sometimes it gets just lip service. The doctor says, well, you should also exercise. Well, in a lot of the rural areas, like where Linda and I are, the facilities are, if they're available, of poor quality, small, and hard to get to. The YMCA is an amazing place, but for most of Hawkins County, not an accessible option. So encouraging the smaller communities to invest internally in building facilities that are needed for these kinds of activities.
One comment too, the thing that all of us running our businesses or whatever organization you're involved in, we get so busy that we get bogged down within internally. and we don't know what's going on at Eastman or any of the other businesses. So I just, from this, I don't know who leads the effort, but something in a community like this where we know we have problems, what is the next step to have a forum in place to where somebody leads the effort to where you have information sharing? You're able to benchmark each other instead of just your own industry, and learn from each other, in all the different categories on what we can improve on going forward.
That's a great point. Yeah, I sometimes say we're all too busy to get anything done. We're going to take a moment. I'm going to turn off my mic, and we're going to turn this mic on and allow you all to ask panelists questions. Uh-oh, I did something wrong.
No, you did everything right.
I did everything right. Paul is paid to say that.
I am.
So just please, we have about 10 minutes. Please keep your questions brief and let the panelists answer them.
My name's Owen. Do that work? My name's Owen Poole. I work with, I can't hold a job, so I do a lot of different stuff. But the reality is, I get to work with qualified medical professionals. And I want to ask a question and ding our group at the same time. Qualified medical professionals was one of the top performing ACOs in some ways, depending on how you calculate it, in the top 10 on cost and quality nationwide, second in cost, calculated to a normalization value. And we've reached out in a number of these areas. Yes, it's Medicare. What did we do wrong, and I take total blame for that on behalf of Qualiable, that we didn't take an independently motivated 500 physician group and not create an easy way to connect to you? Because if we can do it with the seniors, we should be able to make it a community-wide effort, and I feel directly responsible for that. So I wish I could get a little feedback on how we could leverage that into this population with the kind of help and advice we might have on this panel.
Any, my microphone's not on.
I guess just a comment, I guess your question is, what can the medical community locally do to impact employers and going?
How can this medical community that's been doing this with seniors create a better, easier interface for you to leverage?
Yeah, yeah.
That's where we failed you.
Yeah. I heard a comment earlier that, one of the things is the medical community visiting with employers in the area to see what the jobs entail to help you provide a better workplace to get employees back to work if there are issues. So I think I think HIPAA probably has built a wall that shouldn't be there in some regards as far as how we can communicate with each other. But it's I guess both sides reaching out. It's who takes that first step to ask for that help and do it the right way.
Paula, behind you. Oh.
Good morning. My name is Aubrey Lee, and I teach in the School of Business and Economics at King. And for those HR people on the panel, I worked in human resources for Alcoa. I worked in healthcare administration in the hospital just up the hill, Johnson City Medical Center, for several years. And my concern is rural hospitals. I grew up in Lee County, Virginia, just across the mountain. I've lived in East Tennessee all my life. And my concern for rural hospitals, as most of you know, may or may not know, the hospital in my hometown was closed by Wellmont a year ago this past October. There's no hospital within 20 miles, and the closest hospital of any size is Holston Valley Hospital, about 45, 50 miles away. So how, in light of reduced funding, rural areas have a very high Medicare, Medicaid population. The Commonwealth of Virginia hasn't accepted the Medicaid funding, as is the case with Tennessee. How does all this bode for rural health care, rural hospitals, when very often health care is driven by market share, not by health care needs? Thank you.
Amanda, thoughts? I suppose it ties in some ways to your comment earlier about how health care is paid for.
That's a very tough question. I work across the street from a rural hospital, and I could throw a rock at it. It's that close. And if it wasn't there, I really have no idea what would happen to my patients. We're close partners. The physicians that work there, all of the staff are both my patients and my friends, and they take care of the patients in the community more than just their hospital stay. They're in their homes. They're checking on these people. They're making sure they get to their appointment with me. It's about making sure the community that's supporting these hospitals understands the risk that they're in, so that they can influence their legislation and they can raise their own funds to help and be really involved and aware of what's going on, instead of unfortunately finding out when it's too late that your small town hospital is closing because of the way things are being paid. So I think these conversations really educate folks about, hey, I need to stand up for the healthcare rights that I have.
Aubrey, one quick comment too, just from an employer standpoint. You know, the rural hospitals in this state are important to our employee base, but the employer is pretty much out of this equation because it's all about who is in network with the insurance providers. So we're pretty limited on what, you know, impact we have.
Good morning. My name is Kathy Pierce. I'm the Executive Director of the Northeast Tennessee Workforce Investment Board. Our organization is totally focused on providing well-educated, well-trained employees in our talent pipeline. The number one issue that has been coming to the fore for our group lately has been the issue of employers not being able to hire people who can pass a drug screen. And so our board is beginning to focus on what the issues may be around that as it relates to employment and economic development. So I don't really have a question as much as that comment and a thank you. I want to thank East Tennessee State University, Dr. Peck, I see you over there, and the work that you guys are doing in the College of Public Health to raise awareness of that problem and to begin to draft strategic solutions for helping us to work on that condition. I also want to thank our county mayors and legislators who also at the local and state level are working on that. It is a huge problem for us as we recruit workers and train workers that when they finish, they can't get a job because they can't pass a drug screen. So thank you for this forum, for the opportunity to be here, and for the work that you guys are doing to help promote a solution to that problem.
Thank you very much. Paula, behind you, I think there's a question.
Good morning. Thank you all for being here. And hi, Kathy. I was hoping someone would bring that up, and when I raised my hand, it was before I knew she would bring that up. So I'll ask a more specific question to Mr. Kinser and Mr. Stuckey. Do you have drug-free workplace programs? I'm sure that you do. And how are they incorporated into your overall wellness program? And what benefits are you seeing from those programs if you do have them? Thank you.
Well, I'll start with that one. That's a fairly straightforward and easy question. Listen, you know, look, for the health and welfare of our community, you have to be drug-free to work for us, okay? We do pre-employment drug screening. We do random drug testing. We can have operators in our facility using drugs. It just, you know, it just can't happen. We want the best and brightest in our workplace, and if you can't meet those standards, you're probably not going to get employed by us. It's simple as that. I mean, the reality of it is you're going to be screened, and you can be randomly screened as well. And so you got to pass physicals, pre-employment drug screening. It's really important, as you know that. You know, the community give us a right to operate and a license to operate, so we want to take care of our community from a safety and wellness standpoint. And we want our employees to be safe, and we also, and to us, that's part of health and wellness when you think about it, when someone is using substance abuse. And if we find an employee who actually fails a drug test, we will put them through rehab. The first time around, they could be disciplined, and if they don't get their act together, ultimately they're going to be terminated. It's a pretty straightforward issue here.
Ditto that, almost identical. The important thing here is to drill down to the high school students and the college students. You're not going to get a job. There are very few employers out there that do not drug screen pre-employment. If you come to the workplace and you have an accident, not even your fault, you go to the doctor for an accident, you're going to be drug screened. If an employee in your department, in a general Shale plant, has a reason to go to their supervisor because of actions you have done that seem to be unsafe, and we have that validated, you'll go for a drug screen. So the important thing here is the young people coming into the workforce the next few years need to hear that, because you're not going to get a job with any of the good companies out there today. It's just not going to happen.
I just want to touch on that too. I've had the opportunity, I've seen some of the faces that have talked on panels. You know, you've got to work on the educational side of this. Shaming is not the answer. In a lot of cases, when folks are getting put in prison, they're going to get out of prison and continue to abuse. I've heard Dr. Lloyd talk on this quite a bit. I think he's absolutely right. The impact, and Kathy, I appreciate those statements you made. The impact that prescription drug abuse is having on our region is significant. And we've got to look at a way to educate the folks to not go down that path, but the folks that have gone down that path, to educate them not to go back. And ultimately, this is going to have a tremendous impact, because take an instance where a pregnant woman continues to abuse drugs and only has 1 kid, 2 kids, 3 kids. What's the impact of those kids? That's our future workforce. That's something we really have to work on and educate those folks to change what they're doing.
Dr. Walker, let me come back to the first question we got asked by Owen Poole. I think I owe him a little bit of an answer to his question early on. And so, listen, first of all, your organization has done an incredibly good job helping us, because we partner with your organization in numerous ways to help our workforce from an overall, some of those pre-diabetes and things like that. We appreciate that. I think we just have to try to create more transparency in the system, in terms of, because I want our employees to know what procedures cost, where they can go online and look at, for example, if I'm going to have a hip replacement, what does that cost at a local hospital? What does that cost in the city? What it should be on the national average? And am I paying more than the national average? I want our employees to be great consumers of health care. And one of the things we got to do in this nation, I spent a lot of time in Washington, D.C. on this issue, is we got to create transparency in the system, just like buying an automobile. And once you do that, and employees can be, and individuals in this room, and all of us can be better informed consumers of health care and force the system to do what it does, then we're going to be better off as a nation. So that's important. So I just wanted to add that component to your question.
Thank you. We'll do one last question.
Hi, I'm David Wood. I'm fairly new to this community. I'm the chair of the Department of Pediatrics and Chief Medical Officer for Niswonger Children's Hospital. I really appreciate the emphasis in this panel on the social determinants of health. But interestingly, and I appreciate Mr. Stuckey raising the issue of parents coming into the region and wondering about the health care services for their children. And one of the struggles in this region has been attracting and retaining specialized pediatric care. And there's been some major developments in the last few years. ETSU and Mountain States have partnered to create Niswonger Children's Hospital, and we're trying to recruit and retain specialty services. But the major issues in now childhood, which is really contributing to the longevity of the American population, is managing chronic disease. Children with diabetes. We have epidemics of diabetes. Children with cerebral palsy. These conditions, we don't have services for those children in this region. And I'm just wondering what, and as a business community, what can you do to help us build up some of these more specialized pediatric services so that your families that are coming here will know that their children can be cared for in this region rather than having to go to Knoxville or Vanderbilt?
It's a great question, and I applaud that children's hospital. We need it desperately, and you know that's why we invest in it, and that's why we've helped you with donations to our Eastman Foundation. So I mean, it's important to us. Listen, specialists in this region, particularly pediatric specialists, are important, because obviously if you don't have that type of specialist, I think the other thing the hospital systems has to do is stop competing with one another. When we're small, and you got to say that we got to focus on, if that's the best place for pediatrics, then let's shift everything there. So Alan Levine and I talk a lot. I know he'll be up here shortly, but that's important. So I think we got to figure out what's right for the region, and we got to build up the specialty care and capabilities so we can attract. Because I do find that an issue, and I have had, you know, 1 or 2 employers with potential employees with special needs that turned us down simply because they looked at the accessibility of pediatric care in this region. So I applaud what you're doing, and we got to continue to work together. And I think all of you know that Eastman is committed to this region, and we do everything we can to help it succeed, not only in providing financial means, but also partnering with expertise, and we got to continue to do that. Now, we wish there were other companies here also from an economic development standpoint. We don't have an unlimited pocketbook, okay?
Well, I hate to call this panel to an end. I've said many times that I've never been anywhere in the country where there are more people who care about improving health and the quality of life, and I think our panelists really reflect the broad spectrum of that.